I'm making this video to talk about something very serious. I know it's not the best quality, but you know, tough cookies. A lot of people who are on my Facebook and my Instagram, know that I've been struggling to lose weight, and I really took it serious this year, especially in May. And as of May 2013, I lost about 48 pounds, 48 hard pounds. And no, I'm not done. No, I'm not ready to say my start weight or my goal weight, because it's mainly about health, and the main focus of this video is about health. And I'm just coming to talk to people because it's in my spirit, and I really don't want to get personal and share what I'm going through, but I think it's important. And this is mainly for my people who are overweight. And this is not me getting on a soapbox and going, oh, if I can lose weight, you can lose weight. Nah, that's not what it's about. It's about when you're overweight and you go to a doctor about health concerns or symptoms, the very first thing, and most of the time the last thing they tell you to do is, oh, lose weight and it'll go away. Well, sometimes that's not the case. Sometimes it's something that can be brought on by the excessive weight, or something is going on and they tend to ignore it because you're overweight. And that bothers me a lot. So, this is not really a subject for the men, but if you have a woman you care about, you might want to keep looking at the video. But about 2-3 years ago, I was having these horrific periods. Missing work, can't walk, extreme cramping, bleeding for 2-3 weeks, not 3 to 7 days. Ladies, I'm talking about I got a week off. I was using only pads because I couldn't use tampons because it was starting to hurt. And I was spending like $30-$40 or more on sanitary napkins a month. Like, basically that was like built into my budget. Well, it still is. And it became very stressful. It started affecting relationships because, of course, when you have that going on, you can't be intimate. And you tell somebody, oh, I'm on my period, and they're looking at you like, oh, you liar, whatever. You said that last week. You said it the week before. And it makes it hard to even be comfortable in your own skin because you're always worried about, am I going to bleed through my clothing? You go on a date, you bleed through your clothing, you never see the guy again. That's my predicament, been my predicament. You get close to someone, you only can be so intimate with someone because you're not comfortable with yourself, and you don't want the subject of sex to come up, so you just kind of hold back on that. And with that being said, it starts to basically dictate your life. And for me, trying to lose weight, it was dictating my life. I was afraid to go to the gym. If I exercised, it seemed like I bled more. And with most people know that with menstrual cycles, if you exercise, it tends to help with the cramping. For me, it didn't. I was always worried about, am I going to bleed through my clothing? Being subconscious about these industrial size pads that look like small bed mattresses being seen by people. Just a lot of subconscious things, especially because I bled through my clothes more than once at the gym, and I just had to abruptly leave which is not, cool. You're there 15 minutes, and to have to come all the way across town just to get to the gym, to only spend 15 minutes in the gym is very, very frustrating. Only being able to wear black, buy new underwear all the time, it was just horrific. But back to my main objective is I went to several doctors. I told them my symptoms. They gave me birth control. It didn't work. It made it worse. I was treated like I was some kind of hypochondriac, like I was a drug seeker. I never asked for pain pills. The only thing I ever asked was to make this stop or to find out what the problem was. I went from gynecologist to gynecologist. In between that, every time I tried to see a new gynecologist, the first thing was, are you pregnant? Do you have STD? What was some waiting list? Like, I waited for a month to see a gynecologist. Got to the gynecologist's office. The gynecologist made me wait in the waiting room for 45 minutes. And spent 10 minutes with me, told me to lose weight, and they would put me on a low-dose birth control pill. Everything I have been doing for the last 2 years. I promptly got my purse, and I just left. And once I left out of the office, I cried like a baby because I felt like no one gave a damn about me and my problem. And that hurt like hell. So, recently, this month, I met a doctor, a young doctor, who cared, and I happened to find her through my insurance. Basically, I looked to see who my providers were, got on the internet, and I researched and found her ratings, great reviews. I called her office the very moment it opened. They opened at 8:30. I was on the phone with someone at 8:32. I spoke to the receptionist, and I basically explained my situation. I mean, down to in tears, in hysteria, because I just couldn't take it anymore. I was sitting in my office at work, bleeding, passing these huge blood clots, shaking, sick, couldn't eat, just couldn't function. So she told me, okay, well, we can see you in a week. And at that point, that was the quickest I've ever had someone say, we'll take a new patient in a week. And I said, okay. And then maybe 5-6 minutes later, the office called me back and said, can you come in today? Dr. Barrett is willing to see you today. I explained your situation. This receptionist didn't know me from Adam. Didn't know if I had insurance or anything at this point. She just said, okay, we're going to see you. And went out on faith and got this doctor to see me. And so I said, yes, I'll be there. What time? Got there, was seen. She listened to everything, listened to every medicine I had been on, and listened to the fact that I've never had an irregular PAP, so nothing's showing up on the PAP. Listened to the fact that since May 2013, I have lost almost 50 pounds, and my problems got worse. Examined me that day. Did tests that no other doctor had ever done. Put me on some medication to slow down the bleeding and to stop it to a certain degree, which I never received. Gave me a different type of hormone that I never had. I was being pumped with estrogen, which was a main part of my problem. And opted to do a biopsy on someone who's under 30, which is kind of rare. You don't normally hear about getting a cervical biopsy on someone unless they've had a irregular PAP, and I've never had an irregular PAP. Of course, did all the pre-screenings, pregnancy, even though I haven't been sexually active in years, STDs, and all of that clean, HPV clean. Like I said, I've really been on a health thing, and I do try to take care of myself health wise, saying